welcome to the Art of Being Human. We've been talking about labor and delivery, and I didn't have a chance to finish it, but really what I want to do is to give you an overview. And so I'm in the process now. So what I'm going to do is talk about the 3 stages of labor. Even though I talked about the first stage on the end of the last segment, we didn't really totally finish. So I want to go through the 3 stages of labor. But remember, this is just an overview. My purpose in doing it is I want to go through every phase of development of the human being from birth until death, because we have phases of development that we go through our whole lives, and each phase of development has certain characteristic challenges that we need to face. So I want to go into all of that, and so we're going to take a psychological bent to this. But for now, I just want to go through certain physical things that I think are important. If you're a female and you're going to have a baby, but you haven't learned much about labor or what it's like other than it's painful or what happens, it would be wise for you to get a book on it or to read about it and just to familiarize yourself, because I think sometimes if you can point on it, point to something and say and label it, well, this is first stage, this is second stage, and you can just kind of label what's going on. It makes it more tolerable and it makes it less frightening, especially for a female that's never had a baby before. It must be terrible to have a baby the first time around and not know what's going on. Now, of course, a doctor can explain, a nurse can explain if you're in the hospital, but at the same time, if you have some knowledge, knowledge is power, but I think it also helps you to have less anxiety. The more you know about something, I think the less anxiety that you have about it. So I'm just, for the sake of that, for people, new moms that I'm talking to here, because I don't know who's watching, I just want to make this overview so you get a little familiar with what the process is, because it's a natural process. Women have babies all the time. There's nothing that's bad about it, except, of course, you have to handle the pain or whatever comes up. So when you get pregnant, you should talk to your doctor about various things, like what's the best place to go to have the baby? Should it be a hospital? Should it be a birthing center? Do I have any medical conditions that would make a hospital better than a birthing? And what happens if there's an emergency? And what about pain control? How can I control the pain myself? Is there anything I can do to make it less? Or should I not bother? I've had women tell me they wouldn't consider having any pain medication. They just follow what their bodies want them to do, and the babies come. I've had women say it doesn't matter, and the baby is better off without medication, so they don't want to have it. I have mothers who have said that they're so proud of themselves because it's like a badge of achievement. They've had a baby without medication. And there's just so many things you can learn and so many things you can read about. And women are very prone to talk about their experiences when they've had a pregnancy or when they've had a baby. And sometimes you just have to stay away from the drama, because the worst stories they can think of, the things that happened to them that were awful, are the ones they're always going to tell you. And if they do that, then you're going to be frightened to death. And you don't need to be frightened to death. If you have good doctors and a good place to have a baby and you're well taken care of, most babies are born very normally without problems. But let me go over the 3 stages of labor. Stage 1. It's the longest phase. The cervix is dilating, and it gets really painful. The uterine muscles are large. They've stretched to accommodate the baby. They're very strong. The contractions can be very hard, and the contractions can come every 3 to 5 minutes. Sometimes every 2 minutes they'll come. And when that happens, that can last for hours. That could be the longest part of the delivery process. Then you get into the transition stage. Now, the transition stage is a part of that first stage of labor, and the contractions can be 2 minutes long and last for about 90 seconds each, with only 30 seconds recovery time between when the contractions start. Now, my mother used to say that it was, for her, one long pain. She didn't have any recovery time. As soon as one pain stopped, another one began. So I'm not surprised to hear people say that. Relaxing techniques can help reduce the pain. Stage 2 is when the cervix is fully dilated and there is an urge to push. The body really wants to push this baby out. And I want to mention the baby also helps out in its own delivery. When my twin sisters that were identical were stillborn, my mother said it was harder to have a baby when you have a stillborn one because they can't help out. The babies themselves help out when they are when in the process of delivering. And there's no way of helping out for a baby to help out if it has passed in the uterus before it was born. So the labor becomes more difficult without the cooperation of the baby. But at any rate, there is an urge to push, and you feel intense pressure. And when the baby's head starts to come out, that's crowning. The baby's head will show, and that's crowning. And then there can be a burning sensation as the baby is coming out. That's called the ring of fire. But I've also read that contractions sometimes slow down during this period as the baby is being born. And some women can actually doze off a little between the contractions. But the baby will be born at this point, this stage 2. The baby's head will come out. Once the baby's head has come out, then the rest of the body follows quite easily. Once the head comes out and the shoulders come out, which would be the largest part of the baby, the rest just follows. And then stage 3 is a simpler stage. The placenta comes out. And it has to be checked to make sure that there's nothing wrong with it, because otherwise you don't want to have infections and so forth, so that has to be checked. But at any rate, stage 3 can happen within a half an hour, or sometimes 5 or 10 minutes. So those are the 3 stages of labor. And then when the baby is out, the baby is out. There are different methods of pain control. As I've said before, you should talk to your doctor about it when you know that you are pregnant for sure. You need to make plans. If you want an epidural, I've read that you should not wait too long because it can only be given at certain times. And if you get to the transition stage where the baby is actually going to crown, it's too late to get an epidural. You just have to go through it. Now, I've heard a lot of comments about labor and delivery from various women. I've never had a child myself. Many women want a natural delivery because they think it's better for the baby. And you need to talk to the doctor about what will happen. Some women have a lot of back pain when they're having labor because the pain starts in the back and it circulates to the front. And that's a possibility that could happen to you too. You have muscle spasms and so forth that are going on in that whole area. So sometimes it's a back labor and then it proceeds to go to the front. The muscle spasm, there are medicines you can take. There are shots that you can be given of narcotics to help ease the pain. Some people use water. They sit in a tub, and that relaxes their muscles and gives them relief of pain. Sometimes they use birthing balls where they're sitting on a ball and they can bounce up and down if they want to, and that seems to help with the pain. So there are various things to try. If you're a new mom, you don't know what works best with you until you try it. So you just need to talk with a doctor and find out something that's best with you. And remember, whenever you're fearful, that's going to increase the pain because it's going to increase the tension in your body, and your body has to react to that. Plus, you're having the spasms of the uterus. The baby's trying to get out. Your body's trying to push it out. The contractions are getting harder and harder. I mean, I can certainly understand why a woman would be fearful, and that will increase the pain. Now, I've heard various things about women that women have said. One woman told me that the pain will get to a certain point and then it won't get any worse. Now, I don't know if that's true or not, but that evidently was her experience. And so maybe that's true. I can't say, I don't know. And then one told me that she would never use pain meds because she just did what her body told her to do, and the babies would come, and it was fine for her. And then, of course, other people recommended water births, exercises, or walking around, so that if you stay in one place, you know, your body doesn't loosen up, and so therefore if you can walk around during the delivery, or squatting down seems to help because it seems to open the cervix when you squat down. So there's all kinds of things. If you look into it, if you get books on it, there's a lot of things that will be said in the books that I don't have time to cover here. But as I said before, I only want to give you an overview of what it's going to be like now. So we're assuming now that the baby has been born, most babies born safely, so we're through that. And I want to review with you the growth stages from birth to death. And we are going to take those one at a time. We'll probably have enough time to do the first one, which is the neonatal stage. Remember, when conception occurs, the baby is first a zygote. And then they're a blastocyte when they travel down the fallopian tubes to the uterus. And then about 6 weeks, they become an embryo. And a lot of development occurs in this embryonic stage, so it's critical there are no malformations with the embryo. And then at about 10 weeks, it becomes a fetus. And it remains a fetus until it is born. Then after it's born, it becomes a neonate. So going from neonate, going through life, neonate is the first month. Infancy is the end of the first month until 15 or 16 months when the baby, starts to walk. Actually, the baby starts to walk and then it becomes a toddler. So infancy is the end of the first month until the 15th or 16th month when the baby walks. Then the toddler goes from about 16 months until about 2.5 years. By that time, they're talking a little. Now, 2 years old, they don't talk much. I saw a television show about a little girl who was 2 years old, and she must be brilliant. She talks like an adult at 2 years old. And she'll say things like, I don't understand adults, but then why would I? I'm only 2. You know, she has a concept of, I'm 2 and I don't understand the adult world because I'm only 24 months old. That's got to be brilliant. And she just talks like a normal person. If you heard her talk, I mean, her voice sounds really young, but if you heard her talk, she would sound to you like she was like a young adult. I wish this woman, she was on a plane, I wish this woman would stop talking to me. I want to get some rest. Now, she's only 2 years old and she's talking like that. And then she says, well, I made a mistake in my diaper, so therefore maybe no one will talk to me now. What 2-year-old understands things like that? I mean, it's not normal. It must be that she is very, very precocious. Most babies at 2 years old, at toddlerhood, they're just beginning to learn how to talk. It's kitty, and it's doggy, and it's mommy, and it's daddy. And that's about all they can do at that age. So there are a lot of individual differences in the development of a baby, and toddlerhood is basically a walking baby. So toddlerhood, 16 months to 2.5 years. Preschool starts from 2.5 years to about 6 years. Childhood starts from 6 years old to about 12 years, and it ends at about junior high. You have early childhood, middle childhood, and late childhood. And then after the childhood period, then you get into adolescence, and this age ranges from age 12 to 20. And the young adult from 20 to 35 years, middle adult from 35 to 50 years, late adult to 50 to 65 years. I don't know what I am. I'm a lot older than that. Old age is 65 and up. And up, you know, up can be up quite a ways. So those are the various stages. Now, I'm going to start with the neonatal period, which is the newborn. We don't realize it, but newborns have an awful lot to adjust to. They've received their nutrition. anything that has to do with their development while they're in the womb. All of the needs for their oxygen, all of their needs for moisture, all of their needs for anything has been taken care of by the mom while they're in the womb. When they get out of the womb because they've been born, all of a sudden they're breathing on their own for the first time. They are making noises with their throats and their vocal cords for the first time. They are blinking their eyes and moving without any support from a placenta for the first time. There's an awful lot to adjust to. So the basic problem or challenge of the neonate is just to survive, to grow enough and to get the organs working together so that they can survive. The organs have been working, but not outside of the womb. And so this is a whole major period of adjustment for an infant. So this is what I'm going to read off what they have to do. It takes 2 to 4 weeks to adjust from birth to living in the outside world because it is so different. The baby is born and can function normally, but the organs are functioning, but not necessarily together. Their organs are normal for the age, but they have a lot of adjustment to do in order to be able to function in the outside world. So the baby's challenge is to be survival, fit, and also just to be able to live. Okay, it takes 2 to 4 weeks to adjust from prenatal to natal after birth. Everything is new. Breathing, digestion, eyes opening, seeing, breathing, everything is responding to the air around them, responding to the noises around them. Everything is totally new. It takes 2 weeks for the circulation to stabilize. It takes 10 days for the blood pressure to become normal. And they can only digest very simple foods, no starches at all. The lungs are congested because they've got moisture in them, and they regurgitate their food. You know, babies throw up. Their digestive systems are very sensitive. And so to feed them milk, to feed them, to nurse them, or to feed what the baby, it would be some kind of milk or formula at this age, the digestive system just isn't used to it. So even though it's like you get something that's new, but it doesn't quite work right, there's nothing wrong with it. It has to adjust to whatever's going on around it. So there are all of these adjustment things. The baby probably won't be able to see for a little while. The eyes haven't learned quite how to focus yet. They can hear, but not very much because the ears will be filled with fluids. The breathing is going to be noisy and shallow. How come? The muscles of the breathing apparatus and the lungs and the diaphragm, they haven't adjusted quite yet. They're not coordinated. They're there, they're working, but they're not coordinated. They cannot adapt to temperature changes. You have to keep a baby warm. The perspiration glands are not going to operate for a month. They are susceptible to intestinal and respiratory problems. They are actually susceptible to skin infections, so you have that to deal with. The baby just has to get used to things. The baby is going to be sleeping most of the time, and he's going to be groggy. He's tired from being born, and also if there was anesthesia, he might be affected by that too. He has fitful starts and shudders. This is when he's there, and all of a sudden he jerks. You know, it's like the nervous system is not quite mature enough to control that. So when the nerves put out an impulse, it travels all the way through the body. Nothing stops it, so the whole body jerks. So it's called fitful starts and shudders, and it's due to an immature nervous system. And the nerve stimulation spreads through the body. This is just the beginning of it. Now, I'm going to close it here because I want to get into next time the reflexes. The newborn infants have reflexes that adults don't have, and they last for a while and then they go away. And so I want to get into those reflexes, but I don't have time to really finish with them. So So I'm going to wait next time to do them. And I'll probably review the neonatal information that I just gave you. It's just adjustment right now and survival before he gets to the infant stage. So I'm going to close it here. Please join me next time.